joint we're going to be using here is our shoulder joint. So what we're trying to demonstrate with this motion is an abduction and adduction. So an abduction is an upwards movement, where an adduction is a downwards movement. So to demonstrate this, I'm going to be doing a fly. So to start, I'm going to have my legs parallel to one another. I'm going to slightly bend my knees, and I'm going to lean forward, keeping my back straight. And then I'm going to bring my arms down and together. I'm going to bring them up till they're level with my shoulders. So you should feel the contraction here. You should feel it in your shoulders. And then going to release, and you should feel that contraction release. So this upwards motion, this is an abduction. This downwards motion, this is an adduction. So as you're doing this motion, you're moving along a sagittal plane because you're moving out to the sides. Your limbs are going sideways. And therefore, you're going along a frontal axis. The next joint we're going to be using is our lumbar spine. So what I'm trying to demonstrate here is a lateral flexion. So I'm going to be doing side oblique crunches. So I'm basically just going to be crunching up to my hip. So as I crunch, you can feel the flexion here in your rear side, your posterior side, you feel it. And then I'm going to release, and you feel it release. You go back up, you can feel the contraction, you can feel the flexion. So as you're doing this, you're moving along your sagittal plane because, again, you're moving to the side, you're moving sideways. So you're using a frontal axis. The next joint we're going to be using is our shoulder girdle, so our scapular, our shoulder blades. The muscles running along here. So what I'm trying to demonstrate is protraction and retraction. So I'm going to demonstrate it with a push-up. But basically, protraction is going to be when your shoulders are arched forward like so. And then retraction is going to be when you're coming down and your shoulders, your shoulder blades, your scapular, they're coming together. Their tension is coming together. So, I'm going to go in push-up position. So right now, this is protraction. My shoulders are curled in forward together. And then going to go down. This is retraction. My shoulder blades, my scapula are coming together. Protraction, retraction. So as you're doing this motion, you're actually moving along a frontal plane because you're going forwards and backwards, which means you're moving along a sagittal axis. The next joint I'm going to be using is my knee joints. So what I'm doing here is a V-sit. I'm trying to demonstrate flexion and extension. So what I'm going to first do is sit on my butt. I'm going to lift my legs up and I'm going to extend them out straight. So this is my extension. I'm then going to bend my knees. I'm going to bring my legs in. This is flexion, extension, flexion. So this particular move actually uses your transverse plane because you're basically splitting your lower body and your upper body. So, with that being said, you're running along a vertical axis. The next joint I'm going to use is my hip joint. So, I'm going to be doing a side leg swing. What I'm trying to demonstrate here is a medial and lateral hip rotation. So, to start, I'm going to cross one leg over the other, and then I'm going to swing a leg outwards. So this outwards motion, this is lateral rotation because I'm coming away from my midline. Now coming in, this would be a medial rotation because I'm crossing my midline. So lateral rotation, medial rotation. So once again, you're moving along a sagittal plane because side to side, which means you're using a frontal axis. So the next thing I have to explain is tensegrity. So tensegrity is basically the ability for a structure or an object to keep itself stable with the use of tension. For example, I made this little diagram here. So as you can see, as I pull on the popsicle sticks, no matter which way I pull them, everything else is always moving. The elastic bands, the sticks, they're always moving in some way. So basically what they're doing is they're distributing that tension, that stress. They're evenly distributing that throughout all the points, all the joints. Connective tissue, muscles, skin, they all have tensegrity elements to them. They're tensile structures, I guess. So another thing to note is that when I'm not applying pressure, nothing is happening. Like, I have to be applying my own force for this to be contracting or retracting. So one example for posture of how this relates to posture, I guess, would be your lumbar spine. Your vertebrae aren't just simply stacked on top of one another, right? There's spacers that go between all those vertebrae. So basically what those spacers are doing is they're allowing more space for that tension to be distributed, for that compression to be distributed. Because if you just had your bones simply stacked on top of one another, like, that would be a lot of pressure in one area. So your spacers basically move to keep yourself level. So how this applies to posture, I guess, would be when you take a step, for instance, your center of gravity is being moved, it's being changed, it's being thrown off. So as you take a step, those spacers in your spine, they're adjusting. The tension in them is contracting, retracting. You know, like, one thing about them too is that those spacers can also become more flexible and not just contract, but they can loosen up as well. So in all, they're really there to keep you level, to adjust to how you move, to keep you upright.